Good morning. This morning we're talking to Dr. Smith. You're the owner of Innovations Dentistry at 146th and Memorial in Bixby. And this is really, really cool. You're going to be donating Halloween candy to the military troops overseas.
That's right. That's right. We're looking forward to the upcoming Halloween holiday, and we thought this would be a fun way to do something where we could give back to the community.
I was thinking about this. I'm like, okay, now he's a smart man, because when all the troops get back, all the soldiers are gonna be like, man, I need to see a dentist. I've been eating all this candy.
No. Well, that wasn't the intent behind it. But basically, Operation Gratitude is basically just a care package program that they've developed, and one of their programs happens to be a candy care package that is sent over to troops overseas. And basically what it is, I'm a parent. I have two young daughters, and they can't wait for Halloween to get here. And every year, it seems to be that we have all this candy, and what are we going to do with this? And typically we just throw it away. And I kind of came across this charity and saw where it's as easy as just getting it into a box and mailing it off, and they get it to troops overseas that otherwise might not get a package from the States for several months. And so we just this is an easy, fun thing to do, and anybody could help do it. So,
what do they just drop it off at 146th and Memorial?
Absolutely. Our at Innovations Dentistry, we've been here about 6 years now, and serving the Bixby and South Tulsa community. And all we're asking is anybody that feels like they have excess candy, or any parents that are kind of feel about it how I did or do, and say, gosh, we have all this excess candy, our kids don't need it. What are we going to do with it? And they can just bring it by the office and drop it off, and we'll make sure that it gets to Operation Gratitude and to the troops overseas.
Now, with Halloween this week, parents, they need a little advice on how much candy they should let their kids enjoy. What are some tips that you can offer some parents?
Well, you got to remember who you're talking to here. You're talking to a dentist, but I think reality. The biggest thing is just safety, and the first thing that in my mind, and my own children, my own girls, is just safety, and making sure they wear something reflective, such as a glow stick or some type of reflective clothing when they're out on Halloween night trick or treating. It makes obviously we were with an adult, but other things that come to mind for me, just in what I do, is things that could be a choking factor for a small child. Hard candy or something like that could be a choking issue. But sure, all kids are going to eat candy. I mean, it's Halloween; it's a fun time for kids, and sure, I'm gonna have some candy too, and so will my kiddos. But I think the key line here is just moderation. Candy's fine every once in a while, as a special treat. I think what I usually tell, or what I typically tell patients is, kids should. It's okay to have a little candy now and then, but really it needs to be the an exception and not the rule. So, is
there any candy that we need to stay away from?
I typically, candy that's real sticky, so like a candy corn or caramel or something along those lines.
Oh.
Something that could stay in their mouth for a long time and just be kind of on the teeth for a long period of time. That's what you want to kind of stay away from. So, if I was going to tell parents something to stay away from, or at least really monitor, would be the real sticky stuff. Or the other thing you don't think about is something sticky like a caramel or something like that could knock a dental crown off or something like that. So just things like that, just common sense stuff.
Okay, now Operation Gratitude, how did you get hooked up with them?
It was just something that we just kind of found out about from a friend, and they said, hey, check this out, and so we looked at their website. It's easy to get to, just www.operationgratitude.com, and it can tell you all about their different programs. Matter of fact, if you go to our website at www.innovationsdentistry.com, we have a link right there. You can click on it. You can find out anything you'd like to know about Operation Gratitude and the many different programs they have besides the candy care packages. So, but yeah, I mean, it's one of these things. It's Halloween's an every year deal, and every year a lot of candy excess and probably just thrown away. And this is just a fun, easy way that we can give back to and say thank you to our troops, that are serving overseas for us.
When does this go through? Like, how long do parents have to be able to drop the candy off?
Well, they can drop. We're going to be here. We're telling all of our patients and the public, we're going to receive candy the November 1st through the 15th. But But of course, if somebody stops by a little bit later than that, any time in the month of November, basically, we're going to be taking candy donations, and we will make sure that it gets to Operation Gratitude so we can, get those care packages out. So
again, I'm talking to Dr. Smith. He's at Innovations Dentistry at 146th and Memorial in Bixby, and he's got a really cool thing going. Now, parents, if you're listening and you have all that leftover candy, this is a cool way to give back to our community. Is it going to the troops that are just in the Tulsa area, or is it all the troops overseas?
Oh, it's all the troops overseas, actually. We mail the care packages out to California, and then they disperse those packages accordingly. So it's really it's far-reaching. It's not just here. It goes to troops all over the world, really.
Oh, very, very cool. So you can drop it off anytime between November 1st and November 15th. Now, besides Operation Gratitude, do you guys do anything else with the community?
We try. We have a couple of fun things we do. Each new patient that we see, we donate a tree to the Arbor Day Foundation, and that's a good time, and that's a lot of fun. Typically, our donations go to the reforestation projects that they have, and right now, I believe they have reforestation projects going on in Missouri and Texas due to wildfires and some things that's gone on in the past. But so we, our office just like that. It's just an easy thing we can do. That each time and say thank you to our new patients that have chosen Innovations Dentistry as their dental home, and so we're glad to do it.
I like you, Dr. Smith. You don't really ever hear stuff like this. My dentist is doing stuff for the military. I don't know. What do you guys? So if I were to come in as a new patient, what services do you guys offer there?
Oh, we're a general family dental office, and we offer any service for you and your patients and their families, anything from just basic cleanings, to cosmetic makeovers with porcelain veneers, but from basic, children's dentistry to bleaching trays to, athletic mouth guards. I mean, we can just do a little bit of everything, and that's typical of a general family dental practice like we have, and we like doing it, and our staff has a good time treating the patients and their entire families, and so, and we have some other fun things. We have the CEREC OmniCam, which is a really neat machine. I mean, it's unbelievable how technology is advanced in the dental world. But it's a machine that can make a crown in one visit. And so, we kind of pride ourselves on that, and trying to offer some really nice dental treatment to the people of Bixby and South Tulsa, and try to use the latest technology if possible. And so that's what we do.
Besides not brushing your teeth, what do you think the biggest mistake that people make when it comes to caring for their teeth?
Oh, you know what? Just on a daily basis, just, seeing patients day in and day out, I'd probably say we kind of miss on flossing. I can't stress flossing enough, and making sure that you are brushing and flossing twice a day, and not missing on that. And so those would probably be my, the biggest take home. That's probably the thing I see missed the most is probably forgetting about how important flossing is.
Well, because it takes time,
I know, it does. I understand that, but usually what I tell patients is how to tell their kids is, hey, throw a song on, make sure it's a couple minutes long, throw your favorite song on, and brush your teeth, and keep brushing your teeth till that song's over, and then once you get done with that, put that song on, that same song on again, and floss your teeth, or pick your next favorite song and then floss your teeth to that. So that's usually what I tell patients, or have parents tell their kids. So
it's so weird that you're saying that. The other day I was on iTunes, and there's an app, and it had 5 stars, and all the reviews on it were just excellent, and they were talking about, and it was a dental app, and you could actually, I don't know, you brush your teeth, and they're like, oh my gosh, I did not realize that 2 minutes takes this long.
You wouldn't think 2 minutes is very long, but boy, it's a lot longer than you think when you're brushing your teeth. But yeah. I saw that app the other day, and I thought it was genius because basically kids and patients can kind of customize the song they want.
Yeah, it's like a DJ.
I thought it was pretty innovative and just a good idea. So.
Dang it, you should have thought of that, man.
I know. I know. I wish I would have. I need to develop an app, right?
If you're just tuning in, it's Dr. Smith. All that leftover Halloween candy, you're like, what do I do with this? Don't throw it away. Go by and see Dr. Smith. He's going to take care of it for you. He's actually going to give it to Operation Gratitude, and he's going to give it to our troops. I think this is so cool. I'm looking on your website. It's innovationsdentistry.com.
It's right. It's www.innovationsdentistry.com, and if anybody's out there that's would like the opportunity to donate some candy or get rid of excess candy, just go to the website. You'll see the Operation Gratitude tab in the upper right hand corner and click on that. It'll explain the program and what we're doing and why we're doing it and how it's going to work. And so, and also, feel free to call us. It's 918-366-9500. Any of our staff would be more than happy to help you with this and answer any questions you may have about it. And, at the end of the day, it's just a fun way and an easy way we can say thank you to our troops that are serving overseas for us. And then also, get rid of some excess candy or otherwise, that we might just throw away. So.
What do you say to people that I've always wondered this, because I lived in Las Vegas for a little bit, and I hate to admit this, but I didn't go to the dentist when I lived there because I went one time and I was like, I didn't feel comfortable there. What do you say to someone that, let's say they don't do that, because you're supposed to go every 6 months?
Well, yeah, I mean, typically we ask patients to come in every 6 months so we can keep track of things. And, other times it's once a year, just depending on the situation, but typically it's once every 6 months. And it's just really important to kind of keep that consistency so that from a preventative standpoint, we can make sure that we stay ahead of any issues that may come up. So, what I always tell patients is, listen, we want to just make sure that, we never have to address anything, meaning, we hope we can keep you to a point where you don't develop cavities or we don't have to do any type of dental treatment with these preventative appointments with cleanings and fluoride treatments and things such of that nature. And so really, the coming in every 6 months is just so we can keep track of those types of things and make sure if something does develop or if an issue does come up that we can treat it very early on in the process and be as conservative as possible. So that's really the whole idea behind it.
Okay, well, what are the long-term side effects?
Well, of not coming in every, if maybe, let's say maybe you haven't been to the dentist in 3 or 4 years, or, one of the biggest things we always worry about is developing gum disease. And if your gum health goes, that can be very detrimental to your oral health and your overall health. And so, obviously developing cavities could be an issue that have gone undetected just because you haven't been in for an examination. That could be bigger issues than they would have been if, say, you would have caught them earlier. So, just those types of things, just being able to catch things early and treat things early on with very conservative measures, obviously, is always in a patient's best interest. So it's less extensive work and it's less expensive work too, when you really think about it. So, that's what I typically tell patients. So really we just try to stress prevention. I mean, that's really the key. And that's really what dentistry, kind of prides itself on, is prevention.
Okay. I'm going to ask a question. I don't want you to be weirded out. What about stinky breath besides brushing your teeth? Because sometimes you don't carry around a toothbrush. What's the easiest way to get rid of it?
Oh, you know what? People all the time forget. You need to brush your tongue as well. Need to brush your tongue as well. As important as brushing and flossing are twice a day, make sure that part of brushing your teeth is brushing your tongue. And I think a lot of people just forget that. And then also, use after you brush and floss your teeth and brush your tongue, get an over-the-counter medicated rinse. That's, any of the Listerine products or any of the Crest Pro Health products or, Colgate has products. Look for the ADA seal of acceptance and you really can't go wrong. But I think, if you're worried about bad breath and you're noticing that, the first thing would be, make sure you're not forgetting to brush your tongue.
And don't be making out with people if you're not brushing your tongue. People don't like that. All right. Well, Dr. Smith, you have been awesome. I need to come check it out. So it's 146.
146 Memorial. We have a map on our website at innovationsdentistry.com. There's a map there where you can check out our location, or feel free to call us at 918-366-9500. We'll be more than happy to, help you with any questions you may have. And, our website has a multitude of videos that you can look through and just kind of find answers to commonly asked questions. And, but again, feel free to call us as well and be happy to answer any questions you may have.
And it's Operation Gratitude. It is Halloween season. We're having a lot of candy in our mouth, and we're having a lot of candy left over. So cool thing about it is Dr. Smith is going to take care of that leftover candy, send it overseas to the troops, and that way they can enjoy Halloween too, maybe just a little bit after the 31st.
That's right. That's right. We're looking forward to Halloween, and we are more than happy to take anyone's excess candy, and we'll get it to Operation Gratitude for them.
All right. Thank you so much, Dr. Smith.
Hey, thank you. Have a good